So Joyce, you mentioned now the pathways were designed that, to be reasonable for 80% compliance, and that, there are those patients that for whatever reason, and often it's patient-specific issues,
Mm-hmm.
right? So
Right.
it could be they live so rural that you're going to have to, the regimen that required weekly administration is not going to work for them, whatever it may be. And so two things. One is the patient preference impact on the compliance. And then for those individuals, those physicians, the individual physicians who are not able to achieve that 80% compliance, is there any engagement from a higher level in the practice to try to rein in their compliance?
So the first question about patient preference is very, very important. And it's critical, and that is a reason to deviate from the pathways. For example, there are women, and Bill have seen this many times as well, there are women who will decline curative therapy for their breast cancer because of unwillingness to have alopecia. Now we have some scalp cooling, but it's not covered by insurance as of yet, and so it's costly, and so it's not available to everyone. So to be able to substitute an agent, a chemotherapy agent, thankfully these are oftentimes old generic drugs. They're not very expensive, but they're still off pathway to avoid alopecia and save a life. Got to do it, you know what I mean? And so there's an example where patient preference is front and center. Got to do it, and so that's great. That's why the flexibility is there, In terms of the situations where people's practices doesn't, allow them to stay within the, I think it's 75%, I think it is, I'm somebody who has to deviate, quite a bit. I see complex metastatic patients, and, they'll be on their 10th line, and there isn't anything on the NCCN guidelines for 10th line. So I'm off label, like I said, thankfully, a lot of these things are not very costly. They're, old generic drugs, but still they're off pathway. So sometimes I've not had problems, and I have to be quite flexible. Sometimes I've never had a problem staying within the, the 75%, whatever it is. I think that for docs that really are falling out, I think there are a look as to what's going on. Is it their particular patient practice? Is it something that they aren't really kind of aware of different options that they can use within the pathways? Or is it somebody I think it's kind of unusual that people are way off the reservation these days. I really don't think so. But yeah, there's definitely educational processes. And, I think ultimately, there could be financial implications just in terms of shared governance within large practices where decisions have been made that with regard to, bonus structures or any kind of profit sharing, that there could be some diminution of that for people that are, way out there who, are, if you will, going their own way. I'm not aware that happens. It hasn't come to my consciousness in my universe of the people I work with, but I suppose it happens in very large practices.